Hello, my name's Jason Whiting. I'm a lead author in the article I Am Now in Dialogue, Becoming More Relational in Couple Therapy. Now, it may seem obvious that couple therapy should be relational, but it can be challenging for couple therapists and all therapists to think in relational terms, in part because most of our traditions of therapy come from Western individually oriented models that are medicalized, for example, that focus on things like assessment, diagnosis, and treatment. And even when we think about working with couples, we're often doing things like giving them individual assessments that ask them about their individual relationship satisfaction. So the words that we use and sometimes the jargon that we use in therapy is different than the way couples talk or the way they experience things that are relational, like love or betrayal or pain or loss or things like that. So in this article, we provide a strongly relational framework for couple therapy that draws upon philosophical perspectives that assert that we are fundamentally relational rather than individual in our own experiences, that we, for example, form our identities in interaction, that we are ethical, and that we derive our sense of fulfillment from relational experiences. So that helps us think about couple therapy instead of being a medical intervention where you go back and forth between two different people. Instead, it is a form of dialogue. It is a type of relational inquiry. So, just as one example, the philosopher Martin Buber talks about how we are always in one of two different relationship styles, either in an I thou mode or an I it mode. And an I thou mode is where I can see myself in relation to you, the thou, and you are a fully formed person with legitimate needs and desires and are just as valid as I am. If instead I'm in an I it mode, then I see you or others as objects, either that are irrelevant to me or that can help me or that can hinder me in some way. And in the article, we talk about a few different issues that come up in couple therapy, like conflict, like abuse, violence, and control. And abuse is one of those examples where using these kinds of terms, this relational language, helps us understand that in violence, a person really has shifted into an I it mode in an extreme version where they see the other person as an object that deserves to be punished, for example. It's also why when people misbehave with things like abuse or mistreatment of each other, they have to rationalize their behavior because it doesn't feel good to be hurtful to another human being because we are relational, we are ethical at our core. And when we're in a relationship, that changes both who we are in relation to each other, and it also introduces these issues of accountability. And accountability is one of those other areas that becomes highlighted when you use strongly relational language. For example, you will hear people say things where they're resisting accountability, where they're making excuses for their bad behavior, for example. And this is especially obvious in things like violence or addiction or betrayals or things like that. So strongly relational language helps us identify those kind of ethical issues. So hopefully this article is helpful for therapists as well as those who train therapists to invite us to examine how we are in our therapeutic interventions. Are we in an I it objectifying, diagnosing mode, or are we in an I thou mode, seeing our clients as people, and then how that helps them do the same with each other. And what that can do is help therapy to be a place for dialogue and interaction rather than debate or discussion, even. Instead, we are seeing and helping clients see each other in strongly relational terms, which is really a deeper, more systemic way of thinking, and hopefully will help people become more deeply connected in their own relationships.